Hi, Dr. YASS here. This is a video to discuss the way by which you can measure success of treatment, regardless of the treatment, when dealing with pain or other symptoms. The general premise, if you're having pain, is that if somebody provides some sort of treatment and the pain is no longer experienced, that somehow that is a representation that the tissue in distress was addressed properly. There is no longer distress of the tissue, and therefore that tissue is no longer emitting pain. You have to recognize that this is basically nonsensical, because if I was to sever your head, for instance, I would imagine you wouldn't feel pain that was being elicited at the knee any longer, but that clearly wouldn't represent any change in the tissue at the knee that was creating your pain. So when the medical establishment is incapable of identifying the tissue in distress and resolving the distress of that tissue, they move on to the classic ways of masking your symptoms. Cortisone shots, epidural nerve blocks. They've tried antidepressants like Cymbalta. You've got your opioids, right? All that kind of crap, right? So when you're looking at them moving to that point, what they're basically saying is they give up. There is absolutely no way we could identify the cause of your pain, so we're just going to try to mask your symptoms. But you can't be fooled by this. You can't say to yourself, wow, I'm not experiencing anything, therefore whatever tissue's in distress is no longer in distress, and therefore I should be okay with this concept, right? So let's say you're having back pain and you cannot function, meaning you can't stand, you can't sit, you can't bend, you can't kneel, and someone says, you know what, I got a way to resolve your pain. I'm going to tie you to a bed for the next 6 months. Well, the high probability is that you're not going to have any pain. And so I guess someone might say, wow, look, that was successful. You don't have pain anymore. But is it successful? What kind of life do you have being tied to a bed? Not exactly much of a fulfilling life, right? So, what is the only true method of representing success in treatment? It's functionality. Functionality. Almost every one of you will describe the fact that your symptom comes when you try to perform a task and can't. I can't bend down. I can't kneel. I can't sit. I can't stand for a long period of time. I can't reach. I can't perform my job. I can't take care of my child. I can't. Everything is about you can't do something, and the inhibiting factor is pain. So when you tell me that you can't walk because you have knee pain and someone gives you a knee replacement and you no longer have knee pain any longer, and they say, look, it's a success, but in the meantime you're limping, or you were told not to play golf or tennis or kneel or bend or do anything, that's not a representation of success. You went to the medical system because you had an inability to perform your task. You expected to be able to perform that task at the completion of your treatment. So this idea, and I'll tell you one story that is still a chilling indicator of this. I was at a store and I see a lady try to get up from a chair, and she is crippled. She's using a cane. She is so unstable by the time she stands, even with the cane, that I was pretty sure she was going to fall. And I overhear her talking. Somebody who obviously knew her said, so how did that back fusion work out for you? And she says, fantastic, fantastic. I don't have any pain any longer. In the meantime, she's freaking crippled. She's going to fall. She's going to break a hip. It's just a question of time. But the fact that she doesn't have a pain at her back due to an inability to perform any task any further is not a representation of success. What kind of psychotic person would say to this woman, great job, you can barely stand up without being able to fall, but because you don't have any pain any longer, great success. You're insane to think that that is successful. So from now on, if someone's trying to determine success in their treatment for you, The answer should never be, I no longer have pain, especially if the surgery was performed on the left knee and inside of 2 to 3 months you're having pain on your right knee. Don't tell me that the success was in resolving the left knee pain and that magically the right knee pain is some new incident. All you have to do is look at the fact you're no longer weight bearing on the left leg. You're fully weight bearing on the right leg because the surgery led to swelling and pain associated with the surgery, which led to the muscle straining even further, which is why you can no longer weight bear on the left leg, which is why you're excessively weight bearing on the right leg, which is why you now have right knee pain. And trust me, you will go back to the very same surgeon and now he's going to tell you, oh, now you have arthritis on the right side, so you need a right knee replacement. Anyone seeing this who has gone through this process knows this is exactly what happens. The surgery doesn't take the pain away. The inability to weight bear on that side any further because of the post-surgical swelling and pain leads to the pain going away. But you just created a situation where on the other side, you're set up for pain. And until you can use your legs equally, you will always have pain. So from now on, use the YASS method mentality of how to determine what is success in treatment, even surgery. Full return of function to an equivalent level prior to you having symptoms is the only true method and mechanism for identifying success. Decreasing or resolving pain is not the answer as long as you do not achieve a full return of function. All right. Key and important information for you so you can decide how to address your symptoms properly and establish what type of treatment is successful or is not. All right, if you like this video, please give it a thumbs up. If you like the types of videos that are being provided on my YouTube channel, Dr. Mitchell YASS, please subscribe. You will get notifications as I put out more and more videos. And for anyone who's looking, you're seeing lots and lots more videos coming out because actually I just have more time now to be able to provide them. But they're all applicable. They all directly talk to you as the individual to help you understand why you're having your symptoms and how to address them appropriately. If you want to reach me, you have a question, you can contact me at my email address, drmitch@mitchellyass.com, drmitch@mitchellyass.com. If you want to get a Zoom or Skype session set up, by all means do so. Same thing. Contact me at my email address, drmitch or mitchellyass.com, drmitch@mitchellyass.com. All right, so that's the end of this video. Thanks for watching. For now, this is Dr. Mitchell YASS wishing you a pain-free, fully functional life. Bye-bye for now.